perhaps we talk a little bit about pregnancy and multiple sclerosis. And so, Dr. Akai, what happens during pregnancy in a person with multiple sclerosis?
Well, Sid, thank you for that question, Dr. Lai. So pregnancy is very interesting when it comes to MS. Generally, the body has a reduced immune system during this time to accommodate the growing fetus with the mom. And so, with that in mind, we can say that pregnancy is an immune suppressed state. Specifically, when it comes to multiple sclerosis, there are several things that we have to take into consideration. And what we have observed over the years is that prior to pregnancy, it's essential or it's important that we have some stability of MS symptoms, making sure that no relapses or treating relapses or no MRI activity with the medications that we have the patient on prior to pregnancy. The risk of relapse during pregnancy is broken down into different parts. So for the first trimester, early second trimester, the risk remains the same prior to pregnancy of a relapse. But what we found over time is that in this late second semester going into the third trimester, the risk of relapses reduces. And this is all due, we postulate, to the hormonal levels that can occur with the change in the bodies due to pregnancy. So most women find that during the late second trimester and third trimester that this is a feel-good period for that. But every good thing comes with this downside, right? And after pregnancy, when hormonal levels drop, then the risk of relapses increases. So it's important to really plan out pregnancy with MS. Talk with your healthcare provider in terms of timing, in terms of the medication, make sure that there is the ability to reduce the risk of relapse over time and give the best experience possible for the mom.
On the other hand, obviously, luckily, multiple sclerosis is not a high risk state by itself for multiple sclerosis. So just because somebody that has multiple sclerosis, it is not a state where somebody needs to, just because they have MS, work with a high risk obstetrician. Obviously, other things could potentially be present too.